Hey guys, welcome to another exciting podcast on an exciting topic in an exciting class. Let's see how this goes. Learning objectives, once again, who cares? Sexual dysfunctions, exciting stuff. So to begin with a quick history lesson, there's this guy back in the day, he started researching human sexuality. And what he was trying to say was that the difference among sexuality amongst people is quantitative rather than qualitative, and that a low sexual desire was due to a deficiency in erotic capacity numerically rather than a qualitative deficiency in mental health. So to fast forward, these two other people, they wrote a book. This book was titled The Human Sexual Response. And as you can tell by the title, it describes the human sexual response. Basically, they describe it as a cycle which overlaps. And this overlapping cycle has three phases: the excitement phase, the orgasm phase, and the resolution phase. And if you're really interested, their book is on sale on Amazon, $650. You can grab it now. You know what? I'll even include the link in the video description. So don't forget to check that out, guys. Exciting stuff. So now that we're done with history, we're going to go ahead and overview sexual dysfunction. So sexual dysfunction is best defined in terms of the couple rather than the individual persons. So ladies, don't be blaming the guy for every little thing that happens, all right? I'm watching y'all. Also, these dysfunctions can affect any of those previous three stages that we had just talked about. And remember, those stages were excitement, orgasm, resolution. Excitement, orgasm, resolution, just in case y'all forgot. So sexual dysfunction is defined as the absence of sexual desire and the interference with the natural response that ultimately leads to orgasm. And to diagnose this, it needs to persist for about 6 months. So just like most of the other psychiatric disorders, you need at least 6 months of persistent symptoms, and obviously it needs to cause some kind of distress in the patient. Otherwise, who cares? So here's a table of all the different sexual dysfunction disorders. They're pretty self-explanatory. As long as you read the name, you could figure out what the problem is. So I'm not going to waste my time describing each disorder. If you could read the name, you could figure out what the disorder is. So if you can't read, maybe it's time to look for a new career path. So real quick, to contrast female arousal disorder from female orgasmic disorder. So in female arousal disorder, you have desire, but their normal physiological response are absent. Whereas in the female orgasmic disorder, you have desire, you show signs of physiologic arousal, you just can't orgasm. So just remember, arousal disorder has absence of physiologic arousal, whereas orgasmic disorder has arousal, just doesn't lead to orgasm. So for those of you listening in your cars, what is vaginismus? Vaginismus is involuntary vaginal muscular spasm. Vaginismus, involuntary muscular spasm of the vagina. So for epidemiology, normally I'd say who cares, but as this semester has shown, they like to ask us stupid questions. So most common disorder in men, primary premature ejaculation. Should be obvious for all the women in the room, I guess. And for women, they have every other disorder. So all the other disorders, most common in women, men, primary premature ejaculation. Sexual disorders are also affected by age as well as cultural and ethnic differences. So the two main contributing factors for sexual disorders are going to be biological and psychological. So for biological, huge influence is sex hormones, and particularly testosterone in males. So just remember, specifically, the only hormone you have to think about, at least for right now, is testosterone, which affects males. Decrease in testosterone, decrease in male sexual desire. Also, specifically with regards to erectile dysfunction, erectile dysfunction can be caused biologically by a mixture of hormonal impairment, neurological dysfunction, as well as vascular dysfunction. So erectile dysfunction caused by hormones, neurological, and vascular dysfunction. And as we know, alcohol and drugs lead to whiskey, you know what, which results in inhibition of orgasm. So treatment of sexual dysfunction, this is going to be sensate focused treatment, has 3 phases. You know they're going to ask us about these 3 phases on the next quiz, so pay attention if you were falling asleep before. So they're pretty easy, they kind of go in order, so you should be able to pick these out pretty easy. So phase 1, non-genital sensate focus, sensate being like sensing, touching, so non-genital touching focus, you're touching everything but the genitals, slow and progressive. Now phase 2 is genital sensate focus. So you're the next phase up, so you're doing the whole body, now including the genitals. Now phase 3 is the next step up, it's penetrative sensate focus. So you're touching everything including the genitals, which ultimately leads to penetrative sex and orgasm. So phase 1, everything without the genitals, which is non-genital sensate focus. Phase 2, genital sensate focus, which is the whole body plus the genitals. And phase 3 is penetrative sensate focus, which is everything, including the genitals, plus penetrative sex and orgasm. So now moving on to biological treatment. So before we get into the specific treatments, we need to review all the comorbidities that can cause sexual dysfunction, or specifically erectile dysfunction in men. And it's going to be 2 main causes. It's going to be blood supply or nervous system supply or nerve supply, whatever you call it, right? So I could see them asking for like 3 causes of erectile dysfunction. Just pick 3 that are the easiest to remember for you. For me, it's atherosclerosis, diabetes, and obesity, because they all go hand in hand. You're obese, you have diabetes, and you have atherosclerosis. So if that works for you, use it. If it doesn't, pick something else. So along with the comorbidities that lead to erectile dysfunction, we also have medications that can cause erectile dysfunction. And like I said before, it's either going to be blood supply or the nervous system. So anything that suppresses the nervous system, like antipsychotics, antidepressants, anxiolytics, anti-epileptics, all make sense. Those are going to lead to erectile dysfunction. Same thing with the drugs that affect the blood supply, beta blockers. Anything that's used to treat hypertension can have an effect on the blood supply, which can lead to erectile dysfunction. The only other drug that was a little, I had to look up, was finasteride, because I forgot what it was. Finasteride is used to treat BPH. So what it does is it inhibits the conversion of testosterone to dihydrotestosterone. So kind of makes sense. It's messing with testosterone. So anything that would probably decrease the concentration of testosterone or make it less available would lead to erectile dysfunction. Not sure if that's the exact mechanism, but it makes sense in my head. Hopefully it makes sense in your head too. And again, this is another one of those where I feel like it could be quiz question, so just try to find a way to memorize this part, whatever works. Now moving on to the actual treatments themselves. For men, we're lucky enough, we have this awesome device, the penis pump, infamous penis pump. Yeah, not much else to say about it. You pump it up, causes erection. Fun stuff. Now for the treatment of sexual dysfunction in women, you're going to be seeing that most treatments are aimed towards postmenopausal women. And that's going to be through either manipulation of the androgens, so specifically testosterone, or via estrogen, either topically via vaginal cream or via oral replacement. Now, of note here is that there's one specific treatment mentioned for premenopausal women. This is for women with low sexual desire. And this medication here called flibanserin, which it does something with the serotonin, doesn't really say how it's done, but basically it works to improve and increase sexual desire in premenopausal women. So just keep note of that. Flibanserin for premenopausal women. Okay, so now we're moving on to paraphilic disorders. So for this, I'm going to do it a little differently. I'm going to do more of a ask a question, do an answer, question and answer type of lecture from here on out, just because it's mostly definitions. I'm doing this mostly for myself from here on out, just because I listen to it in the car. Feel free to continue listening, obviously, if that's something that will benefit you as well. So what is paraphilia? What is paraphilia? Paraphilia is a condition that's characterized by an abnormal sexual desire that typically involves extreme or dangerous activity. So it's not what's conceived as normal activity. This is extreme and or dangerous activities. So what is paraphilic disorder? Paraphilic disorder is when the paraphilia, so the abnormal sexual desire, leads to subjective distress, so distress for the person, or social impairment to that person, or something that causes harm or threatens the other individuals involved. So for symptoms, I'm sure we all understand what the symptoms of paraphilia are, so I won't belabor the point. So paraphilic disorders have two broad categories. They're either anomalous activity, so they either characterized by an abnormal sexual activity or an abnormal sexual target. So name 3 courtship disorders. 3 courtship disorders. And also, are courtship disorders considered an anomalous activity or an anomalous target? Courtship disorders are considered an anomalous activity. They have an abnormal activity. So the 3 types of courtship disorders are 1, voyeuristic disorder, 2, exhibitionist disorder, or exhibition disorder, or 3, frotteuristic disorder. All right, and next, what is another type of anomalous activity preference other than courtship disorder? That would be sexual arousal associated with pain, and those 2 types are what? Sexual sadism as well as sexual masochism. Sexual sadism and sexual masochism are considered sexual arousal associated with pain, which are considered anomalous activity preferences. Now for the anomalous target preferences, these are pretty obvious. You have the pedophiles, you have the transvestic, as well as the fetishistic disorder. So they're either pedophile, they have fetishes, or they're transvestite. Excuse my dog playing with his dog toys in the background. So what is voyeuristic disorder? Voyeuristic disorder is essentially the peeping Tom. They get pleasure out of observing an unsuspecting person, usually a stranger who is naked or in the process of disrobing or engaging in sexual activity. So basically the peeping Tom. Now the next type of courtship disorder, the exhibitionist disorder, is basically what? That's right. These are the people who like to exhibit themselves. So these are the people who show up on the subway and disrobe and do all that weird stuff. They typically want to shock the observer, and they get off on hoping that the observer will become sexually aroused. Now, what is frotteuristic disorder? Frotteuristic disorder. Frotteuristic disorder is someone who becomes aroused by touching or rubbing his genitals against non-consenting individuals. So you're on a bus, this person comes up to you and he starts rubbing himself on you. He has a frotteuristic disorder. So this paraphilia has basically the same diagnostic criteria as every other disorder. Needs to last at least 6 months and needs to cause significant distress or impairment, consistent with everything else. So sexual sadism versus sexual masochism. So sadism is the individual that likes to cause harm to someone else, while sexual masochism is the one who like to become humiliated, be bound, etc. So masochism, me, M, and sadism is onto the other person. So what are the two main criteria for being a pedophile? What are the two main criteria for being a pedophile? So this also takes place over a 6-month period, but it typically involves children 13 years or younger. And the pedophile must be at least 16 and 5 years older than the child. So the victim is usually 13 years or younger, and the perpetrator, the pedophile himself, must be at least 16, and the victim must be 5 years older than the pedophile. So what is fetish disorder? What is fetish disorder? Fetish disorder is sexual arousal with a non-living object, most commonly women's underwear, women's shoes, etc. And then what is transvestic disorder? What is transvestic disorder? This is cross-dressing for the purpose of sexual arousal. Cross-dressing for the purpose of sexual arousal. So paraphilia, most common in men. 95% who seek treatment are men. Makes sense. You guys watch the news. You guys know men are freaking crazy. I'm sure there's no argument with any of the women in the class. So contributing factors to these weird people, they have neurological abnormalities, no kidding. Fun fact that I could see them picking out of a hat is that pedophiles and exhibitionists show subtle dysfunction in the left temporal lobe. So pedophiles and exhibitionists show subtle dysfunction in the left temporal lobe. So left temporal lobe dysfunction causes these individuals to turn left in life and go crazy. Social factors include problems in social relationships and impaired personal skills. Makes sense. And then they have distorted love maps. Love maps are mental pictures representing a person's ideal sexual relationship. So Obviously, that's distorted because these people are freaking weird. So treatment of these disorders, you have aversion therapy. So aversion therapy, the goal is to create a new association with the inappropriate stimulus, whatever it is, and the goal is to have that stimulus no longer elicit sexual arousal. So you want to cause that stimulus to cause like negative thoughts in your mind whenever that person thinks about it. And then of course you always have cognitive behavior treatment. And that treatment is based on the belief that these people have this condition due to deficits in cognition as well as social skills. So the treatment is aimed at increasing education, improving social skills, and preventing relapse. Now lastly, gender dysphoria. Hopefully the neighbor's annoying dog doesn't bark through the whole video. So what is gender dysphoria? What is gender dysphoria? Gender dysphoria is the sense of discomfort with one's anatomical sex. So it's discomfort with one's anatomical sex. What is another name for gender dysphoria? What is another name for gender dysphoria? Transsexualism. Another name for gender dysphoria is transsexualism, which makes sense. We've all heard the word transsexual. So the symptoms are self-explanatory, just like the other conditions. They need to last for a 6-month duration, and there are 6 criteria. So I don't really care about the epidemiology of gender dysphoria, so read this at your own request. Now the cause or the etiology of gender dysphoria is believed to be caused by sex hormone imbalance. This is based on studies on pseudo-hermaphroditism. So treatment of gender dysphoria is a mixture of counseling, sex hormones, or gender reassignment surgery. However, those aren't always wanted by the patient. And that concludes this lecture on this super interesting subject. Don't forget to hit like and subscribe, guys. See ya next time.